Have you ever been caught off guard by an expulsion of gas so stealthy, boisterous, or unequivocally pungent that it left you flustered, clutching your midsection, or perhaps subtly implicating your innocent pet? Perhaps it's that sulfuric odor that lingers like an uninvited guest, the explosive cannonade that startles everyone nearby, or the quiet, spasmodic puff that strikes with a wave of discomfort. Ladies, we've all encountered these moments, and it's high time we discuss them openly. No embarrassment, no pretense. These are more than mere awkward instances. They are your body's communication, and disregarding them could mean overlooking something significant. In this presentation, we are going to unveil what these emissions, be they malodorous, vociferous, or discreet, might be conveying about your well-being. If you're watching this video, comment "great" right now. From dietary modifications to crucial indicators like irritable bowel syndrome, or even colorectal malignancy, you need to watch until the conclusion because we're sharing actionable strategies you can implement immediately to heed your body, assume command of your health, and live with assurance. No mortification necessary. Before we commence, I would genuinely appreciate it if you would give this video a thumbs up. It truly assists me in continuing to disseminate valuable insights for graceful aging. If you haven't yet subscribed, I strongly advise you to subscribe and activate the notification bell so you don't miss any forthcoming content. If you appreciate this video, please indicate your approval by commenting "valuable." Conversely, if it doesn't resonate with you, comment more facts to provide me with feedback so I can enhance future videos. Now, let's begin. Let's start by delving into one of the most concerning and unforgettable types of flatulence. 1. The lingering sulfurous odor. Ladies, let's engage in a forthright, no-nonsense discussion about that elusive, sulfurous aroma that permeates the atmosphere like an unwelcome attendee at a social gathering. You know precisely the kind of expulsion I'm referencing, the one that assails you with a powerful, eye-watering, putrid egg stench capable of evacuating a room faster than an alarm. It's the sort of smell that compels you to fling open every window, ignite numerous aromatic candles, or perhaps cast an accusatory gaze at your canine companion, your grandchildren, or even that venerable sofa that has graced your family since the early 1970s. However, deep down, you're aware of the truth. You know precisely the origin of that offensive smell. More crucially, you need to comprehend what your body might be attempting to communicate when it unleashes these pungent emissions. That unmistakable sulfurous scent, the one that seems to hover in the air like a regrettable memory, typically originates from a gas known as hydrogen sulfide, generated within your digestive tract during the process of digestion. Now, let me be clear, an occasional pungent expulsion is as normal as momentarily forgetting where you parked your automobile at the supermarket. Certain foodstuffs are notorious for instigating these aromatic eruptions. Consider eggs, broccoli, cauliflower, cabbage, or those delectable sausages you couldn't resist at the local community center buffet. Even red meat, legumes, or a particularly generous serving of garlic bread can precipitate an emission that smells as if it belongs in a chemical laboratory. These provisions are rich in sulfur containing compounds such as methionine or cysteine, which your gut microorganisms break down into hydrogen sulfide. An occasional subtle odor, no cause for alarm. Your body is simply performing its customary functions. However, when these sulfurous gaseous emissions become a frequent occurrence, perhaps multiple times daily, and the odor is so potent it could strip paint from walls or compel your card game companions to reevaluate their seating arrangements, that's when you must take notice. Persistent, malodorous gas that lingers like an unwanted house guest could be your body's way of signaling a malfunction within your digestive system. Medical professionals point to a few potential culprits when the stench transforms into a chronic issue, and it's imperative to understand them so you can assume control of your well-being. One potential underlying cause is malabsorption, which is a sophisticated term for your body failing to properly break down or assimilate nutrients from consumed food. This can transpire for a multitude of reasons. For instance, lactose intolerance, where your body struggles to metabolize the sugar found in dairy products, can lead to excessive gas production, often accompanied by that characteristic sulfurous smell. If you've been indulging in frozen desserts or creamy casseroles and observe bloating, abdominal discomfort, or looseness of the bowels alongside the odor, lactose could be the instigator. Similarly, celiac disease, an autoimmune condition triggered by gluten present in wheat, barley, and rye, can wreak havoc on your gut, leading to foul-smelling gas, diarrhea, and even nutritional deficiencies if left unaddressed. Another possibility is an internal parasitic infection like giardiasis, caused by a troublesome parasite you might acquire from contaminated water or food. This infection can result in gas that smells as if it originated from a swamp, along with nausea, fatigue, and abdominal tenderness. But it's not solely about what you're consuming or what might be infecting your digestive system. Sometimes the problem lies deeper. Chronic conditions such as irritable bowel syndrome (IBS) or inflammatory bowel disease (IBD), which includes conditions like Crohn's disease or ulcerative colitis, can alter how your digestive tract processes food, leading to excessive gas production and that distinctive sulfurous aroma. And while it's not pleasant to contemplate, we must discuss the more serious possibilities. In rare instances, persistent malodorous gas, particularly when coupled with symptoms like unexplained weight reduction, the presence of blood in your stools, or alterations in bowel habits, could serve as a warning sign of colorectal cancer, especially in women beyond the age of 60. I'm not presenting this information to induce panic, but rather to empower you with knowledge. Colorectal cancer is among the most prevalent malignancies in women, and early detection can be life-saving. Now, I understand what you might be thinking. It's just gas. Everyone expels gas. Why make such a fuss? And you are not mistaken. The expulsion of gas is a natural facet of human existence. The average individual passes gas between 5 and 15 times daily, and most of the time it is innocuous. However, far too many of us, particularly women of a certain vintage, were raised to conceal such matters, to be deferential, to avoid discussing our bodily functions, especially the less glamorous aspects. We were instructed to smile through discomfort, to disregard the signals our bodies transmit, and to never, ever admit to something as unladylike as an emission of gas. Well, ladies, I'm here to assert that at this juncture in life, we have no time for such absurdities. Your body is an extraordinary mechanism, and when it begins sending you signals, whether it's a sulfurous odor, bloating that renders your attire uncomfortably restrictive, or bowel changes that simply don't feel right, it's time to pay attention. Comment "attentive body" if you agree. Allow me to share the experience of my dear friend, Joan, who learned this lesson through a challenging ordeal. For many years, Joan dismissed her persistent flatulence as merely a sensitive digestive system. She would jokingly brush it off at our weekly discussion group, attributing it to her renowned lentil soup or the occasional glass of dairy. But her abode began to acquire the scent of a sulfurous mine, and her husband, bless his kind heart, ultimately persuaded her to consult a physician. It transpired that she had a condition called small intestinal bacterial overgrowth SIBO, where an excessive proliferation of gut bacteria was fermenting food in her small intestine, generating copious amounts of gas with that characteristic putrid egg smell. Left unaddressed, SIBO could have led to nutrient deficiencies or even more severe complications. However, with a course of antimicrobial agents, a few dietary adjustments, such as reducing fermentable carbohydrates, and a daily probiotic supplement, Joan was restored to her vibrant self. Her living area no longer reeked of a chemical spill, and she felt better than she had in years. So, what action should you take if your emissions are incapacitating people like tear gas? Firstly, do not simply reach for air freshener or attempt to blame your feline companion. Begin by maintaining a straightforward food and symptom journal for a week or two. Document what you consume, when you observe the gas, and any other associated symptoms such as bloating, diarrhea, or abdominal discomfort. This practice can assist you in identifying recurring patterns. Perhaps dairy or gluten is the trigger, or perhaps that new high-fiber beverage is causing digestive distress. Next, Consider implementing some dietary modifications, reducing your intake of sulfur-rich provisions like eggs, meat, or cruciferous vegetables, broccoli, cabbage. Brussels sprouts might prove beneficial. If you suspect lactose intolerance, try substituting regular dairy with lactose-free alternatives or plant-based options. Incorporating a probiotic supplement or fermented foods such as yogurt or kefir can also aid in balancing your gut flora, thereby reducing gas production. However, if the issue persists, for instance, if you are still experiencing frequent malodorous gas after a few weeks of dietary alterations, or if you notice other critical indicators like unexplained weight loss, blood in your stool, or persistent diarrhea, it is time to contact your medical practitioner. Do not allow embarrassment to deter you. Physicians have encountered every conceivable complaint, and their purpose is to assist, not to pass judgment. They might recommend diagnostic tests such as a breath test for SIBO or lactose intolerance, a stool analysis to check for infections or malabsorption, or even a colonoscopy to exclude more serious conditions, especially if you are over 50 or have a family history of colorectal issues. The American Cancer Society advises routine colorectal cancer screenings commencing at age 45. Therefore, if you are due for one, now is an opportune moment to schedule it. Comment Proactive Health if you're taking notes. Here is the essential takeaway. Your body is communicating with you, and those sulfurous emissions might be its way of urgently seeking attention. Do not disregard it. Do not feel embarrassed. Be informed, be proactive, and assume command of your well-being. You have earned the right to feel good, to relish your days without apprehension of evacuating a room, and to live your life to its fullest potential. So, the next time that putrid egg odor emerges, do not simply dismiss it with a chuckle or blame your pet. Listen to your body and provide it with the care it deserves. You are capable of this. Ladies, if you are still observing this video and finding these insights valuable, please indicate your continued engagement by commenting one below. Thank you for your valuable time. Now, let's transition to the second type of emission that often sparks concern. 2. The explosive, loud, machine gun fart. Now, let's discuss the kind that doesn't necessarily produce an unpleasant odor, but certainly creates a significant disturbance. You know the one? It gradually builds up. You're seated in a tranquil setting, perhaps a place of worship or a quiet dining establishment, and suddenly it erupts like a brass instrument solo loud, startling, and sometimes a rapid-fire succession of bursts reminiscent of automatic gunfire. You didn't even intend for it to happen. One moment you're serenely sipping your tea, the next you sound as though you're attempting to ignite a large motorcycle. While boisterous gas by itself isn't inherently perilous, when it becomes frequent, for instance, multiple times daily, particularly following meals, and is accompanied by a sensation of gurgling or cramping in your abdomen, medical professionals indicate that it could signify something deeper. Often, these explosive bursts of gas are caused by excessive fermentation within the digestive tract. And this isn't solely attributable to consuming an abundance of legumes or Brussels sprouts. It could be linked to food intolerances or even an underlying digestive condition that warrants attention. For example, lactose intolerance becomes more prevalent as we age, even for those of us who once consumed dairy products without issue in our younger years. Gluten sensitivity can also develop over time. In many instances, the culprit is something known as SIBO, small intestinal bacterial overgrowth, which signifies that an inappropriate type of bacteria is flourishing in the wrong location, generating an excessive amount of gas. These emissions are not merely noisy, they frequently present with abdominal distension, unpredictable bowel movements, and a sensation as if your stomach is an inflated balloon on the verge of rupturing. If you have ever had to unfasten your trousers midway through a meal just to breathe comfortably, you understand precisely what I mean. The challenging aspect is that we often laugh it off. "Oh, I just have a gassy stomach," we remark. Or, "That's what I get for eating cabbage." But when those explosive sounds become a regular occurrence in your daily life, and especially if they are accompanied by abdominal pain or a sudden urge to evacuate your bowels, it is time to cease laughing and commence an investigation. Comment, investigate discomfort. If you're feeling this, and may I just add, from one woman to another, there is absolutely nothing shameful about seeking assistance when your body is not functioning optimally. We monitor our blood pressure. We consume our vitamin supplements. We undergo mammograms. Why would we not approach our digestive health with equal seriousness? So, the next time your posterior begins to sound like a jazz percussionist, do not simply chuckle and move on. Pay attention. Maintain a detailed food journal. Consider consulting a registered dietitian. And if your digestive system is producing more noise than your grandchildren, it might be time for a discussion with your general practitioner. I believe you're enjoying this video. Before we continue, make sure you subscribe, like, and share this video. Comment wonderful if you're enjoying this video. Now, let's move on to the third type of alarming expulsion. 3. The silent but sudden gas with cramps. Let's discuss the type of emission that completely takes you by surprise, the silent, inconspicuous kind that escapes without a sound, an odor, or even a preliminary rumble to forewarn you. One moment you're leisurely sipping tea, engaging in conversation with a companion, or standing in line at the grocery store, feeling entirely well. The next, your internal organs twist as if someone is wringing out a saturated cloth, and a wave of gas escapes so quietly you almost question whether it actually occurred. Then the cramp strikes, a sharp, twisting discomfort that radiates through your abdomen, leaving you clutching your belly or doubling over, pondering what just ambushed you. This is not merely a harmless puff of air. It is a stealthy assault that can leave you disoriented, embarrassed, and frankly, a little apprehensive. These silent but painful episodes of gas are more than just an awkward moment. They can be a critical signal frantically vying for your attention. If you are experiencing frequent gas accompanied by sharp, spasmodic pain or a sudden, urgent pressure that sends you rushing to the lavatory, it is time to consider that something more serious might be at play. One of the most prevalent culprits is Irritable Bowel Syndrome, IBS, a chronic condition that impacts the large intestine and can significantly disrupt your quality of life. IBS is not merely a sophisticated term for a stomach ache. It is a complex disorder that can manifest a constellation of symptoms, including abdominal distension, unpredictable bowel habits. One day you're constipated, the next you're contending with diarrhea, and those sharp, unpredictable waves of gas that seem to strike out of nowhere. IBS is more common than you might assume, affecting up to 15% of adults globally, with women receiving diagnosis more frequently than men. Regrettably, women, especially older women, are often dismissed when they present with digestive complaints, as if abdominal pain is simply an unavoidable part of aging. That is preposterous, and you deserve superior care. These silent, crampy gas episodes can be triggered by a diverse range of factors, including diet, hormonal fluctuations, and perhaps surprisingly, emotional distress and anxiety. The gut-brain connection is authentic and potent. Your digestive system is lined with millions of nerve cells that communicate directly with your brain, forming what is frequently referred to as the second brain. When you are under duress, whether it pertains to family matters, financial concerns, or health issues, your body retains that tension, and your digestive system often becomes the arena where it manifests. I will share a personal anecdote to illustrate this point. A few years ago, I navigated a particularly demanding period when my spouse was confronting a serious health crisis. Between coordinating his medical appointments, managing the household, and striving to remain strong for our children, I was a bundle of nerves. Every evening, with predictable regularity, I would experience a deep, twisting cramp in my lower abdomen, followed by a quiet release of gas that brought momentary relief but left me perplexed and anxious. Was it something I had consumed? Was my body betraying me? It wasn't until I consulted a gastroenterologist that I discovered my stress was essentially constricting my digestive tract, triggering IBS-like symptoms. The physician explained that stress can impede digestion, heighten gut sensitivity, and even alter the equilibrium of bacteria in your intestines, leading to those painful, clandestine gas episodes. If you are contending with these silent but painful expulsions, here is what you need to understand. Document your symptoms. Commence a journal to record when these episodes transpire, what you consumed, your stress levels, and any other accompanying symptoms such as bloating, looseness of the bowels, or constipation. Identifying patterns can aid your physician in pinpointing the cause. For example, certain foodstuffs like dairy, legumes, or high FODMAP foods such as onions, garlic, or wheat can trigger IBS symptoms in some individuals. Comment Symptom Tracker if you're going to try this. Consider stress management techniques. Since stress can exacerbate digestive issues, attempt to incorporate relaxation methods like deep breathing exercises, yoga, or meditation. Even a 10-minute stroll can help calm your nervous system and, by extension, your digestive system. Dietary adjustments. Collaborate with a registered dietitian to identify potential trigger foods. A low FODMAP diet, which reduces certain carbohydrates that are difficult to digest, has demonstrated efficacy in assisting many individuals with IBS. Avoiding artificial sweeteners like sorbitol or carbonated beverages can also mitigate gas accumulation. Seek consultation from a specialist. If these episodes are frequent or are disrupting your daily life, do not hesitate to consult a gastroenterologist. They may recommend diagnostic procedures such as a colonoscopy, stool analysis, or breath tests to exclude other conditions like small intestinal bacterial overgrowth SIBO, celiac disease, or inflammatory bowel disease IBD. Medications and therapies for IBS. Treatments range from over-the-counter remedies like simethicone for gas to prescription medications such as antispasmodics or low-dose antidepressants to alleviate gut sensitivity. Cognitive behavioral therapy (CBT) can also assist in managing the stress component. The fundamental message is that these silent, crampy gas attacks are your body's way of asserting, "Pay attention to me." Do not dismiss them or allow embarrassment to prevent you from seeking assistance. You merit living without the constant dread of when the next cramp will strike or whether you will be caught unawares in public. Consult a medical professional, meticulously track your symptoms, and assume control of your gastrointestinal health. Your body and your peace of mind will express their gratitude. If you are still observing this video and finding these insights valuable, please indicate your continued viewership by commenting below. Thank you for your valuable time. 4. The unintended release, the troublesome whisper of incontinence. Now, let's confront a topic even more challenging to discuss. The subtle, almost imperceptible puff of gas that escapes without any forewarning, leaving you mortified when you realize it has occurred. Sometimes, this realization dawns because someone else noticed first. Or, even worse, because you detect a slight sensation of warmth or dampness where it emphatically should not be. This is not your typical, everyday flatulence that you can dismiss with a laugh or attribute to your pet. This is gas incontinence, a condition where your body releases gas without you experiencing the urge or possessing any control over it. And let's be candid, it is profoundly mortifying. No one desires to admit they have experienced an unintended release. But we are mature women, and it is time to break the silence and address this issue directly. Comment "break the silence" if you feel empowered by this discussion. Gas incontinence is more widespread than you might imagine, particularly as we age. It is frequently linked to pelvic floor dysfunction, which can arise from a myriad of life experiences: childbirth, pelvic surgical procedures such as hysterectomies, prolonged periods of sitting or standing, heavy lifting, or even the hormonal shifts associated with menopause that can weaken connective tissues. The pelvic floor is a complex network of muscles and tissues that function as a supportive sling, upholding your bladder, rectum, and other pelvic organs. When these muscles lose their strength, you may lose the capacity to sense or regulate the expulsion of gas, leading to those unexpected, silent releases. However, it's not solely about muscle weakness. Gas incontinence can also serve as an indicator of more serious underlying health concerns. For example, nerve damage resulting from conditions like diabetes, multiple sclerosis, or even spinal injuries can disrupt the communication pathways between your brain and your rectum, making it more challenging to sense when gas is about to escape. In certain instances, gas incontinence can be a symptom of rectal prolapse, where a portion of the rectum descends out of its normal position, or anal sphincter dysfunction, where the muscles that govern the anus do not close properly. If you are also observing leakage of stool, difficulty achieving complete cleansing after a bowel movement, or a sensation of incomplete evacuation, these could all be interconnected aspects of the same problem. I once knew a woman named Brenda, a dynamic 68-year-old who cherished tending her verdant garden and hosting her weekly gardening club gatherings. But over time, she began to withdraw from those social events, fabricating excuses about being overly occupied. It wasn't until we had a heartfelt conversation that she divulged her apprehension. She was terrified of inadvertently releasing gas without awareness, especially after a few profoundly embarrassing incidents at social functions. The shame was progressively eroding her self-assurance, and she had started to shun the activities she truly loved. It grieved me to witness her retreating from her passions. Fortunately, after she confided in her physician, she discovered that effective solutions existed. Pelvic floor physical therapy, tailored dietary adjustments, and even specific medications helped her regain control and, crucially, her confidence. Comment "regain control" if you find Brenda's story relatable. Here is what you can do if you are experiencing gas incontinence. Consult a specialist. Begin by consulting your primary care physician or a gastroenterologist. However, do not be surprised if they refer you to a colorectal surgeon or a pelvic floor specialist. These professionals may conduct diagnostic tests such as anortal manometry to assess sphincter strength or imaging scans to check for structural issues like prolapse. Pelvic floor therapy. A physical therapist specializing in pelvic health can instruct you in exercises like Kegels to strengthen your pelvic floor muscles. Biofeedback therapy, which employs sensors to assist you in retraining your muscles, can also be highly effective. Dietary modifications. Certain foodstuffs, such as legumes, broccoli, or carbonated beverages, can increase gas production, thereby making unintended releases more probable. A registered dietitian can assist you in identifying triggers and formulating a plan to reduce gas while ensuring adequate nutrition. Medications and medical devices. In some cases, medications like loperamide can help regulate bowel movements and diminish urgency. For severe cases, surgical interventions such as sphincter repair or sacral nerve stimulation may be considered. Lifestyle adjustments. Avoid straining during bowel movements, as this can further weaken the pelvic floor. Maintain adequate hydration. Consume sufficient fiber to prevent constipation and consider scheduled bathroom visits to reduce pressure on your rectum. Mental health support. The embarrassment associated with gas incontinence can significantly impact your mental well-being, leading to anxiety or social isolation. Engaging with a therapist or joining a support group can help you cope and reestablish your self-confidence. The most crucial understanding is that you are not alone, and you do not have to endure in silence or shame. Gas incontinence is not your fault, and it is not something you are simply compelled to tolerate. There are treatments, therapies, and strategies that can effect a genuine transformation. If you find yourself tensing up every time you stand, bend over, or laugh, apprehensive that something might inadvertently escape, please reach out for assistance. You deserve to live with confidence, liberated from apprehension, and fully immersed in the life you cherish. Speak with a medical professional, explore your available options, and take that initial step toward reclaiming your freedom. Thank you immensely for joining me today for this frank, illuminating conversation about our bodies and those unexpected moments that catch us off guard. I sincerely hope you have acquired valuable insights regarding the importance of heeding your body's signals. Whether it's that sulfuric stench, those boisterous, rapid-fire expulsions, the silent cramps, or the concerning whisper of gas incontinence, these are not merely embarrassing occurrences. They are your body's way of soliciting attention, and you deserve to feel self-assured and in command. So, I would genuinely appreciate hearing from you. What is one specific thing you have learned from this video that you intend to incorporate into your daily life? Perhaps it's initiating a food diary, experimenting with a new relaxation technique, or finally scheduling that long-deferred medical appointment. Please share your thoughts in the comment section below. Your insight might just inspire someone else to take charge of their health as well. If you found this video beneficial, please ensure you leave a comment below and do not forget to like, share, and subscribe to our YouTube channel for more candid health discussions. Let's continue this vital conversation and support one another in living our most optimal, healthiest lives. Until next time, take excellent care of yourselves. You've got this, ladies. Remember to subscribe, like, and share. And before you go, don't miss out on our other captivating videos, where we unravel more mysteries of the human body and empower you to live your best life. Explore, learn, and grow with us.